Women's health has always been surrounded by questions, cultural taboos, and unfortunately, a lot of myths. From menstruation and fertility to hormones and cancer, misinformation can make women feel confused, ashamed, or even afraid of their own bodies. But it's time to change that. In this video, we're breaking down some of the most common myths about women's health and uncovering the facts every woman needs to know to make informed, confident choices. Let's get started, because your body deserves the truth. Myth number 1, you shouldn't exercise during your period. Totally false. Fact: light to moderate exercise during your menstrual cycle can actually help reduce cramps, improve mood, and boost energy. Activities like yoga, walking, or swimming help release endorphins, your body's natural painkillers. So instead of avoiding movement, listen to your body and stay active if you can. Of course, if you're feeling weak or dizzy, rest. But remember, menstruation is not a sickness. Myth number 2, any vaginal odor means infection. Not necessarily true. Fact: every woman has a natural vaginal scent, and it changes with your cycle, diet, and hygiene habits. A mild, musky odor is normal. But if you notice a strong, fishy smell, itching, or unusual discharge, it could be a sign of infection such as bacterial vaginosis or yeast infection. So, rather than overusing harsh soaps or douches, which can make it worse, always seek medical advice for proper treatment. Myth number 3, if a couple can't conceive, it must be the woman's fault. A harmful and outdated belief. Fact: infertility affects both men and women almost equally. According to studies, 40–50% of infertility cases are due to male factors such as low sperm count or poor motility. So infertility is not a woman's burden to carry alone. It's a shared health issue that requires both partners to get tested and treated together. Myth number 4, if your period is irregular, it must mean you have a hormone disorder. Not always true. Fact: stress, weight changes, certain medications, and even travel can affect your menstrual cycle. However, consistently irregular cycles may point to issues like polycystic ovary syndrome, PCOS, thyroid imbalance, or perimenopause. The key is to track your cycle and talk to a healthcare professional if irregularities persist. Don't jump to conclusions. Myth number 5, if you feel fine, you don't need to see a doctor. That's a dangerous assumption. Fact: many health issues, like cervical cancer, hypertension, or diabetes, don't show early symptoms. Routine checkups, pap smears, and breast exams help detect problems before they become serious. Prevention is always easier and cheaper than cure. Myth number 6, hormonal changes are bad for you. Not true. Fact: hormonal fluctuations are a normal part of every woman's life, from puberty and pregnancy to menopause. Your body naturally adjusts to these changes. However, if you experience extreme symptoms like severe mood swings, hot flashes, or irregular bleeding, it could indicate hormonal imbalance that needs evaluation. So instead of fearing hormones, understand them and work with your body. Myth number 7, only older women get breast cancer. Wrong again. Fact: although the risk increases with age, younger women can also develop breast cancer. That's why it's important to perform monthly self-breast exams and go for screenings, especially if you have a family history. Early detection saves lives. The earlier it's found, the better the treatment outcome. Myth number 8, all feminine hygiene products are good for you. Not necessarily. Fact: some perfumed soaps, wipes, or douches can disturb your vagina's natural pH and cause irritation or infection. The vagina is self-cleaning. You don't need to use strong chemicals. Stick to mild, unscented soaps for the outer area only, and let your body's natural flora do the rest. Women's health isn't just about treating illness, it's about understanding your body and breaking free from myths that hold you back. If you learned something new today, hit like, subscribe, and share this video to help other women stay informed and empowered. Because when women know the facts, they make stronger, healthier choices.